SpaMedica partnered with OT to have a roundtable discussion about age-related macular degeneration, the importance of timely access to treatment, and the role that community optometrists can play in patient referral and care. First, let's meet our contributors.
My name's Deepal Burgess. I'm a locum optometrist, work mainly around Cambridgeshire and Lincolnshire.
Sandhya Gosai, work for Boots Opticians and in Chelmsford.
With worries about attending medical appointments during the pandemic fading away, are ACPs seeing more patients presenting with AMD in the community?
With an ageing population, I'm seeing more patients that are presenting with drusen.
I think there's definitely been an increase since the pandemic, especially straight after. There was a lot of delay in people coming to get help.
If people are presenting with a progressed stage of AMD, how do you discuss it with them?
I try and not alarm the patient. Using the term AMD can start the patient to panic, can make the patient panic, especially because they know AMD can be a sight-threatening condition. So I like to say you have wear and tear changes at the back of the eye, over the part of the eye that you do your looking with. They seem to understand that more, and they seem, it doesn't sound as dangerous as AMD.
And pretty much the same thing I say as well, wear and tear, and then I generally get a response back, oh, it's because I'm getting old, and I'm like, yeah, we have a bit of a joke about it.
But it's the one sense that patients would hate to lose. I get so many patients saying to me, I can do without my hearing, but I can't do without my vision. So yeah, it has to be handled delicately.
I do kind of just give a hint that it's a long process, but without too much detail. I give them the leaflet, which tells them everything.
When choosing where to refer your AMD patients, what factors do you see as most important?
Getting that treatment in a timely manner is so important, because once the damage is done, it's difficult to reverse. So you have to catch that patient at the right time.
My experience with AMD is that actually I don't think hardly any patients that I'm aware of are waiting beyond the 2 weeks maximum, and they normally are seen within a few days.
With my local eye clinic, the waiting times were already quite long anyway. They were under a lot of pressure. And with the pandemic, the waiting times have become even longer. But I've been really, really fortunate in my area that we've had SpaMedica as a facility that I can refer to, where my patients can access treatment much more rapidly than they would have done ordinarily. So that gave me a lot of reassurance. And obviously people like Amit, who are really, really competent at looking after my patients. So yeah, it's really helped my store generally. And as a clinician, it gives me that peace of mind that my patients are being seen to in a timely manner.
What options do you have for referral in your local area?
So in terms of patient choice, I either have the NHS hospital or SpaMedica. I don't have that many places I can refer the patient to, and I'm swayed by waiting times. I just don't want to run the risk of referring to the NHS eye clinic, not getting any letters back, not knowing how long the referral is going to take. I just can't take that risk. So my choice is heavily swayed to a shorter waiting time, and obviously locality as well.
What factors do you emphasise to your patients when discussing their choices?
You need to go to this place a lot, so things like parking make a difference. Things like, if there's someone who's going to have to drive them, who can take them, that kind of thing. So they don't always go to the closest place to them. And then just make sure that they answer the phone and say it's going to be an unknown number, just answer it. Otherwise, you'll get sent to your closest place. And if you want the choice, you have to answer the phone.
When it comes to referrals and communication, is there anything that SpaMedica does differently?
So I email a lot of my referrals over to them directly. I get a response back pretty much straight away saying that the referral has been received and it will be actioned. Once the patient has been seen and they've had an assessment, I get a letter back from them saying what they thought the situation was, what the management strategy is going to be. And then obviously that's a learning for me as well, that yes, was my original referral accurate? And having that letter, we can also add to the patient's file. So it adds to the history of that patient should another clinician see that patient again. So it's a real learning to have letters back. We don't always get letters back from eye clinics.
SpaMedica are a good example of what good looks like in terms of an AMD service.
SpaMedica are really setting high standards. You really feel like they're putting the patient at the center of everything that they do, offering high levels of care. The waiting times aren't that long. You're well informed. It's like they listen and then they respond. So I think other people can learn from that.